Hello and welcome to the next session in your pathology series. This is Sri Kumar, Professor of Pathology at Masa University, Malaysia. And I continue with the second session on healing and repair. Now, in the first session on healing and repair, we actually saw the difference between healing and repair. We saw what is replacement and regeneration. And we went through a few different types of cells, which are the labile cells, the stable cells, and the permanent cells, a little bit on the stem cells, and we also went through the cell cycle and various aspects of how healing occurs and angiogenesis, fibroplasia, and granulation tissue occurs. Now we move on to the two aspects of healing, which is primary and secondary healing. So a quick summary of what we've seen in the first lecture. So in the first lecture, we started talking about definition of healing and repair. We went on to regeneration, cells, and we spoke about the extracellular matrix, the various components of extracellular matrix, which is glycoproteins, glycosaminoglycans, proteoglycans, and most importantly, collagen. There are 14 types of collagen. And then we went on to see how replacement occurs and granulation tissue is formed. Remember, regeneration is when old cells are replaced, are renewed by new cells. Replacement is when the basement membrane is broken and the fibrous tissue or a scar is formed. In regeneration, it occurs in all the surface epithelium, the skin, the gastrointestinal tract. When it comes to replacement, example is a surgical wound incision or an acute myocardial infarction and so on. And now we are going to continue with what is primary union and what is secondary union. And then we would conclude with talking about local and systemic factors that affect inflammation, that affect healing. Okay, with this, we continue with the session. Okay. Now, the best form of wound healing occurs when the least tissue is damaged, which means the best wound healing would occur in a wound where the incision is cut straight, the margins are close together, there is good blood vessels formation there, and there are no foreign bodies. So an ideal wound is a wound which is a thin slit where the line gets filled with clotted blood immediately, a scab is formed, and it cuts the rest of the healing wound from the environment. This is an ideal wound. So what does an ideal wound look like? It looks like this, where you have a clean incised wound and surgical sutures. Other than a surgical incision, it's difficult to get an ideal wound because when you get hurt, you fall down and you get wounded, you don't get wounded with the intention of forming an ideal wound. When you get wounded, you try to protect yourself, and so it is definitely never an ideal wound. So the most ideal wound that one gets is a surgical scar, a surgical incision which has been sutured well. So when it is sutured well, you can see that there is a very thin line and there is a scab that is formed. It cuts off the healing tissue from the rest of the environment so that this is sterile. In the practical world, you cannot get an ideal wound. The next best ideal wound is inflicted with an incision of a knife, such as this, where you have a knife injury. It could be a stab injury or it could be a slice injury, which occurs in gang fights or what you see in movies. This is a movie where you have Jet Li slashing people with his knife. So this is a knife wound. There are different types of knife wounds, stab wounds, incision wounds, slash wounds. All these are different lectures later on. But at this point, this is a wound where the edges are close together and scab is starting to form. Now, all this wound healing is affected by growth factors and molecular events, which I told you in the previous session, but it is so important that I would mention it again here. There are polypeptide growth factors with pleiotropic effects. Pleiotropic means it helps in proliferation of cells, migration of endothelial cells, maturing or differentiation of endothelial cells, and all this results in angiogenesis. And then proliferation of fibroblasts. And the whole tissue undergoes remodeling. You remember what remodeling is? Where the matrix metalloproteinases eats up the excess of granulation tissue wherever there is a wound, and the wound heals. Some examples of growth factors are epidermal growth factor, vascular endothelial growth factor, transforming growth factor alpha and beta, platelet derived growth factor, and so many others such as fibroblast growth factor, hepatocyte growth factor, keratinocyte growth factor, insulin like growth factor, and cytokines. Most of these growth factors play an important role in angiogenesis and fibroblastic proliferation, which are the key hallmarks of granulation tissue. We spoke about the extracellular matrix. A quick revisit of that again. The extracellular matrix is the scaffolding which supports the body. It is because of this extracellular matrix that I look like this and you look like what you are. If our body was just cells, it would be a bag of cells. But we have a supporting framework, which is the matrix, which is not the blood vessels, but the interstitial space. And it is intact for parenchymal healing. And there are three components: collagens, adhesive glycoproteins, proteoglycans, and hyaluronic acid. These are the components of the extracellular matrix.